Welcome to Dental Notes and Mnemonics. Today we are going to discuss about the discolored teeth and their management. So without any delay, let's get started with the video. Teeth discoloration is defined as any change in the hue, color or translucency of a tooth due to any cause. Restorative filling materials, drugs, both topical or systemic, pulpal necrosis or hemorrhage may be responsible. Discoloration of the teeth can be classified on the basis of several factors, for example, location, etiology, number of the teeth involved. However, the most commonly followed classification is based on the location of the discoloration. On the basis of the location, the staining can be divided into two broad categories. First is extrinsic stains or intrinsic stains. Extrinsic stains occur on the surface of teeth, typically due to external factors such as food, beverages, and tobacco use. These stains are usually yellow, brown, or black in color and are primarily visible on the outer layer of the enamel. They are often found along the gum line and in interproximal area. Example includes the tobacco, coffee, tea, or wine can also cause the yellow-brown discoloration. Plaque buildup due to poor oral hygiene can lead to yellowish staining along the gum margins. Staining may also occur in kids due to iron supplementation or chromogenic bacteria. Even the prolonged use of chlorhexidine can lead to extrinsic staining. On the other hand, intrinsic stains arise from within the tooth structure itself, either due to developmental defects or external agent that have penetrated the enamel. From these two categories, one third classification is the internalized stains. These are the external stains only that penetrate enamel or dentine through the defects or the erosion. So let's discuss the causes of tooth discoloration. We have already completed the causes of external tooth discoloration earlier. Now we'll focus on the internal one. Causes of internal staining can be divided into the developmental causes, post-eruptive causes, aging or systemic disorders. Causes the tooth discoloration that occurs during tooth development due to systemic factors or disturbances in the formation of enamel or dentine. Example is tetracycline staining. It occurs when antibiotics are administered during tooth development. It leads to gray, yellow or brown bands in the enamel or dentine. Fluorosis is a condition which is due to excess amount of the fluoride which is taken during the enamel formation. It appears white, spots, brown stains or pitting depending on the severity of the fluorosis. The mechanism of action of tetracyclines is that it chelates with the calcium in the dentine and fluorides disrupt the amylogenesis process, thus lead to internal staining of the teeth. Hypoplasia, which may be caused by systemic conditions like malnutrition, trauma or illness during the enamel development, can lead to internal staining. It leads to opaque or the pigmented areas due to thin or incomplete enamel formation. Other two genetic conditions which affect the development of the teeth, amylogenesis imperfecta and dentinogenesis imperfecta, they are also a cause of internal staining. Post-eruptive causes of internal staining include a range of factors such as trauma, infection and certain medication. Trauma can result in pulpal damage leading to discoloration that progresses from pink to dark over the period of time. Similarly, pulpal necrosis causes the tooth to appear gray or black due to the breakdown of blood products. Another notable cause is internal resorption, which creates a unique pink hue in the affected tooth. Finally, medications like minocycline can lead to discoloration by altering the dental matrix, leaving a bluish or greenish tint. Minocycline is unique because it can stain erupted teeth, unlike tetracycline, which mainly affect developing teeth. The two factors which are responsible for yellowish and darker teeth with aging are secondary dentine formation, which reduces the translucency of the tooth, and the second is enamel thinning. With age, enamel thins out and worn enamel exposes the underlying dentine. Internal staining may also be due to the systemic disorders like jaundice, which deposits a bilirubin incorporation during the tooth development and results in greenish and yellowish hue of the teeth. Also, porphyria leads to accumulation of porphyrin in dentine, and it gives a reddish brown color appearance. So, coming to diagnosis and assessment of the tooth discoloration, begin by exploring the patient's medical history and the dental history. Check for any systemic illnesses or medications like tetracyclines or fluoride intake. Second involves a clinical examination. Observe the color of the discolored tooth. Shades like yellow, brown, gray, or black can indicate different causes. We have to note that whether the discoloration is uniform across the multiple teeth, suggesting a systemic factors, or localized to a single tooth, pointing to trauma or restoration. Also, we have to assess the surface texture, as smooth surface indicate extrinsic stains, while rough or pitted one hint at intrinsic enamel defects. Specific tests can be done for the deeper insights. Transillumination can help to identify cracks or caries contributing to discoloration. Radiographs can be used to assess the pulp calcifications or any other periapical pathologies. Vitality test checks the pulpal health status, as non-vital teeth often show gray or dark discoloration. Fluorescence is the natural property of teeth to emit visible light when exposed to ultraviolet light, and it is primarily due to the presence of organic component in dentine. Tetracycline staining causes teeth to fluoresce with yellow or green hue under UV light in the early stages. Later on, with time, fluorescence fades as the stain oxidizes, leaving behind a brown or gray color. On the other hand, fluorosis results in chalky white spots or bands that fluoresce brightly under UV light, particularly in moderate to severe cases. Pulpal necrosis can lead to grayish or dark brown discoloration of the teeth. Lack of fluorescence under UV light compared to the adjacent healthy teeth can confirm the diagnosis of necrosis. Trauma without necrosis, fluorescence would be normal, showing a pale blue light under UV light. A normal fluorescent or dull fluorescence indicates that the tooth may have undergone necrosis due to trauma. Developmental defects like amelogenesis imperfecta or dentinogenesis imperfecta often shows distinct fluorescence pattern due to the altered structure of enamel or dentine. These defects may emit blue or amber fluorescence, which is quite different from the natural fluorescence of healthy teeth. So now we'll discuss the management strategies for different discoloration. To begin with, extrinsic stains, the first step is diagnosis and assessment. This involves the three main aspects. First is the cause identification. Second is the stain evaluation to assess the stain's location, its extent and severity. This helps us to decide the appropriate treatment method. And differential diagnosis is also crucial to rule out intrinsic stain, as they require different management approaches. Misdiagnosis here can lead to ineffective treatments. In the management of extrinsic stains, preventive measures play a crucial role. These include three main strategies. First is oral hygiene education. Encourage the patient to brush twice daily using a soft bristle toothbrush and fluoride toothpaste. Flossing should also be a part of their daily routine. The patient should be advised to reduce the consumption of stain producing items like coffee, tea or red wine or other pigmented foods. Patients should also be guided to quit smoking or using tobacco products. Oral prophylaxis is a vital step in managing extrinsic stains. These include scaling or polishing by the use of ultrasonics or hand scalers to remove plaque or calculus, followed by polishing with rubber cup and abrasive prophylactic paste to eliminate surface stains. Air polishing is an advanced technique which combines a high pressure air, water and an abrasive powder, commonly sodium bicarbonate or glycine. It is particularly effective for removing stubborn stains from hard to reach areas, and it is gentle on enamel. A finer approach, micropolishing, utilizes microabrasive tools to target residual stains that scaling and air polishing may miss. It provides a smooth, polished surface, enhancing aesthetics and thus reducing the plaque accumulation also. When the professional cleaning alone is not enough to address the extrinsic stains, white treatments can provide additional support. These treatments are classified into two main types. The first one is an in-office whitening, which involves the use of hydrogen peroxide or carbamide peroxide agents applied under professional supervision. These agents effectively break down the stains or the enamel surface, producing visible whitening results in single session. Second approach is at home whitening. It is for a more gradual approach. Patients can use whitening toothpaste or the custom made whitening trays provided by their dentist. These are designed for regular use and can lighten stains over the time, ensuring patient comfort and convenience. The final step in the management of extrinsic stains is maintenance to help to sustain the results of professional cleaning and whitening treatments achieved. It includes a regular dental checkup in every 6 months. The patient should be advised to use fluoride containing toothpaste with a mild abrasive like silica, which can gently remove the surface stains while protecting the enamel. A patient may be suggested an non-alcoholic antibacterial mouthwashes to reduce the bacterial growth and prevent new stains from forming. About the management of internal staining. First of all, we'll talk about internal bleaching. Internal bleaching is a treatment used to address the intrinsic stain caused by factors like trauma, aging, and the certain medications. The process involves placing a bleaching agent such as hydrogen peroxide or carbamide peroxide inside the tooth. This agent works by breaking down the stain produced from within the tooth structure. External or vital bleaching, it targets a vital tooth which have not undergone root canal treatment. This bleaching process can either be done at home or at a dental office. At home bleaching typically uses custom trays, while in office bleaching involves stronger bleaching agents applied by a professional. In custom made shells applied on to the front surface of teeth to improve appearance. Indication of veneers is intrinsic stains which are resistant to whitening like tetracycline staining or fluorosis with severe enamel mottling. These are also indicated in case of mild to moderate discoloration from aging or trauma or staining which is caused due to the root canal treatment. On the other hand, crowns are full coverage restoration that encapsulate the entire tooth. These are indicated in case of severe intrinsic discoloration. The tooth structure is compromised. In case of RCT treated tooth with structural compromise and discoloration. Microabrasion is used to treat superficial enamel discoloration and stains caused by factors such as fluorosis or tobacco use or coffee staining. It is non-invasive technique to improve the appearance of teeth without the need of more extensive dental treatment like whitening or veneers. This method is used for removing superficial white spots or demineralized area. Its mechanism is that it involves the application of mildly abrasive substance, typically a combination of silicon carbide or aluminum oxide particles to the surface of the enamel. The abrasive particles are applied in conjunction with an acidic solution, which is usually hydrochloric acid, to remove gently a thin layer of outer enamel. This process works by mechanically polishing and chemically etching the tooth surface to smooth out stains and improve the overall appearance of the enamel. Macro-abrasion is used for more substantial enamel defect like thick stains, rough surfaces, or larger cosmetic issues, as is in enamel hypoplasia. It uses coarser abrasive particles to remove larger portion of enamel. Resin bonding can be used to correct the stains that cannot be removed with bleaching or other whitening techniques to restore the natural appearance of the tooth. The color of the tooth discoloration is an important diagnostic feature that helps to identify the underlying causes. Please go through the charts I have provided where I have mentioned the colors and all the possible etiologies behind the color. of the discoloration. About the tooth discoloration and its management, I hope you found the content helpful and informative. If you learned something new, please like, share, or subscribe to the channel for more such content. See you soon in the next video. Till then, bye bye. Take care. Have a nice day.